Hello my friends, today I'm with Eleonora.
Hello.
She's a model and she will help me to show you all about the cervical spine. We can see the anatomy. We will talk about 7 vertebrae, so 1, 2, 3, 4, 5, 6, 7 cervical vertebrae we have in our neck, and I will show you how to find this vertebra on Eleonora. You can bend your head, good. Here I have the occiput, so we work on the head, and I will touch all the spinous processes here. You can see this is the spinous process here, right here, and here the transverse process, so on the lateral side. So I will check the first vertebra under the head and go downwards. I will arrive at the 7 vertebra. What I do now, I ask for an extension. So here I don't feel, I cannot touch here the 7 vertebra. If I do this, I can touch again the spinous process. So here I have the 7, here I have the T1. This is the T1. So the first thoracic vertebra. Okay? Between the head and the T1, I have all the 7 vertebrae that I can show you here. Okay? This is the first part of the anatomy of the vertebra. The second part is about the sections we have inside the neck. So this is one vertebra and another, and we have all the functions that we will see further on the physiology. Now we stay on the anatomy, and I can show you other important sites that we have on the upper thorax. So it's very important to find the first rib. The first rib is here, and I can touch here over my clavicle. So here we have the first rib. Very important to treat some important cervical disease. And then you can see here all the clavicle. This is the clavicle, very important. We will work on it in a few minutes in our treatment. Okay? We have the scapula. You can see here the down corner, here the lower corner of the scapula, here the upper corner of the scapula. This is the scapula. You can see all the image here. And when we find the lower corner, I make a line and I go towards the 7 here, right here, the 7 thoracic vertebra. So this one is T7. Okay, so I can find very quickly this vertebra. Then I go looking for the T4. So the upper corner of the scapula, and here I found the T4. So we have T1, T2, T3, T4. Very easy to find our landmarks. And then I go down, and it's very easy to find the 4th lumbar vertebra. So here I found the L of lumbar 4 here, right here. And when I find here, it's very easy to find the 5th vertebra. So L5, right here. Then here we have the sacrum. So the sacrum starts right here. Okay? And then I will have this triangle right here to have our sacrum. Okay? Now, to find another one, very important one, I will check the last rib right here. So if I follow the rib, this is the rib, so we have another curve.
K12.
Yes, and I will arrive here. So I will find right here, little 3, 2, 1, the last rib here. I have the L1. So L1. So in a few minutes we found T1 and the 7th vertebra, cervical vertebra, T4, T7, and then L1, so it's very easy to find, for example, T12, like here, so T12, and then the rest of the lumbar. So we can divide the spine in 3 points: the cervical area, the thoracic area, so we have 7 vertebrae on the neck, 12 vertebrae here on the thoracic spine, and then we have 5 vertebrae on the lumbar. We can also make an inclusion of the sacrum with more 5 vertebrae of the sacrum. So this triangle, like the bikini, we have the sacrum right here. We can make all these landmarks we found, all these vertebrae we found in the anatomy, in the physiology. So we will see and we will check together the function of this spine, and especially now working on the cervical. So please, Eleonora, you can sit on this side. Okay, thank you.
Welcome.
And we will see together what we can do with the neck. We can make a rotation. This is the first movement we can do with our cervical spine. Then we can make a bending. So we will make this bending on the right and on the opposite side. Then we can make a flexion of the head, and then we can make an extension of the head. These are the most important movements of the cervical. When we start to have some problems with our function, so with these movements, because for example, Eleonora could have a problem making a rotation on the right because she starts to feel some pain. For example, you start to feel a restriction of movement here, so we have less range of movement, less range of motion right here, and you start to feel some pain. We could think about some pathologies. For example, we can have some disease of the disc, like protrusions or hernias. It's very important so to check with some exams just to have an idea, and then we can start to work. So for example, I like to use another test, very important neurological test, because you can make a flexion and then I ask to make an extension with your leg. Yes, on this way I stiff the spinal cord. So if you have, for example, an hernia on your neck, you will start to increase the stiffness of your neck, and then you will feel some pain. So this, for example, is a neurological test to find some neurological disease on your neck, maybe an hernia. We already discussed about the anatomy, the physiology, and the pathology. When we have I need your hand just a moment. When we have 2 vertebrae, one on the upper side and one on the lower side, right here, okay, you can see, the Eleonora's hand is the disc, okay? So, if with this vertebra and the other one, I make a rotation and a compression of the hand, I have a compression of the disc. So, the insider part of the disc coming outside, and we have the hernia. So what I have to do now for the treatment? I have this condition of the vertebra, I will make a crack like this to open, so to make a decompression, and I will show you on the neck of Eleonora. The treatment is very delicate and gentle. I found on this case, there you can see here, you can come here, to find quickly, remember we have T1 right here, now I'm on the 7th vertebra here on the cervical, so I will touch the spinous process and then the transverse right here, and I prepare myself for the technique. So I will check the rotation, I check the range of motion of the neck right here. I make another test on the other side right here. Perfect. I ask to release the muscles, to relax to my patient, and I prepare the technique. So I found all the contacts, okay, relax, and I make the technique. So very easy. I open with my 2 vertebrae, and then I will work on the other side. So I found, on this case, I worked on the 7th vertebra. Now I am on the 6th vertebra. So the name is C6. I prepare for the technique. Okay, relax, and I make the technique. Okay, very easy. I check again because I always make another test after my technique, and then I can work on another part. You can see here under we have the vertex right here, and then on the occiput, so this part, the lower part of the head, I found the first vertebra, the cervical C1, okay, right here. So to find this vertebra is not easy. I need to make a flexion, okay, so I can go inside this little space I can find here, and then I can back on the extension. So I have a good contact on my vertebra to make this kind of technique. It's one of the most difficult techniques, so please, you can lie on your back, face up. It's a very difficult technique to do. Legs contact comparing with other techniques. Yes, so you can see I make this kind of flexion. I found the contact right here. Yes, you can see my hand. I found the contact right here. Okay, this is my contact. And then I came back with a normal extension. Then I prepare for the technique. You can relax. You can enlarge your legs. Okay, good. Relax. Don't help me. I use my chest to close more and increase the bending. Okay, so I can reduce the rotation, because in this case I don't need a lot of rotation but more bending. So relax. Don't help me. Perfect. No worries. No worries. Okay, relax. Don't help me. And I make the technique on the first vertebra. You were a little scared. No worries, trust me, okay? Eleonora was a little...
No, I trust you.
Okay.
Really?
But we made a good job. Now I will check the other side. On this case I work on the 2nd vertebra here, so the C2. In this case I need more rotation and less bending, so it's absolutely another biomechanical notions. And in this case I don't need my chest, I work just on the rotation parameter, so relax, perfect, and I make the technique, very easy. I check again, it's very important to make a test after our techniques, and I already made all my job on the neck. Now we have to work on the rest. So you remember we explained about the clavicle and, for example, the 4th rib. So let's work on the clavicle. I will check the clavicle. On this case I prefer to work on this one because we have an anteriority right here. I let my patient on the supine position, and I will work on the other side, working with this technique. Relax. I have a good contact with the 1st ribs right here, so this is the scapula. I will work on this side right here, and another contact here also on the clavicle. Okay, so relax. With the first part, relax, I will work, yes, on the clavicle with this pressure, and then with the other pressure on the ribs. So relax, good. And I make the technique, very good. Are you okay, Leonora?
Yes.
Okay, good. I will make another technique on the ribs. There you can come on other side, okay. So, remember, we have the scapula, and I already worked on this part of the ribs. Now we have all the vertebrae, okay? So we have many vertebrae here on the thoracic spine, right here. The dorsal spine is starting with the T1 and find the hand on the T12. And on this case, I will check the vertebra with the spinous process. You can see here we have all the different spinous process, and I will also check the transverse process, so the lateral side of the vertebra, right here. This is the contact. But on this case, I prefer to work on the rib. So if we have the spinous process here, the transverse process here, I will find the rib right here, and this is the contact for the rib. So I prepare everything for the rib. I make the test. Now you can lengthen your legs, relax, inhale, exhale, relax, don't help me, good, relax, good. And I make the technique, very easy. Did you feel it on the...
I feel bad.
Okay, you feel good, perfect. Very good. After some years working, you gain the habit to find everything very easy. You don't need to mark everything, so you don't need to find all the landmarks searching for everything, but it will be very fast to find everything, very quick. This is an important way to learn how to find all the points. So I want to work, for example, on T7. I will work on this technique, relax, good. Technique, very easy. Then I want to work, for example, on T4. So I will take the contact here. This is the spinous process. I will stay here, right here. Relax, don't help me. Relax. And make the technique. Right here, you remember, we have the first vertebra. So first vertebra of the thoracic spine, T1. And right here, we have the rib, the first rib. And the second rib. So I will work on this case with another contact, more deep, so deeper than before. I'm not here, but I am here. And sometimes I can also use my thumb right here. Thank you, Bear. Relax, don't help me. No worries. And I make the technique on the first vertebra and on the first rib. Perfect. I'm checking if is everything okay. Yes. And now I will find the contact on another thoracic vertebra right here. So relax your head, drop your head. Good, don't help me. Okay. On this case, it's a very difficult technique because I need to make relax, a bending, a derotation, and a little extension, so it's not safe. So don't do this technique because it's very dangerous. Now don't help me, relax, perfect, relax, don't help me, good, the rotation, extension, relax, and I make the technique. Easy, very good. We will work on one of the most difficult techniques ever, because we will work on a shift, an occiput shift. So I have to find the lower side of the occiput right here, prepare a difficult contact on this side. The contact needs some rotation, little bending, but the goal of the techniques is the shift. So relax, don't help me, okay, relax, good, drop your body, yes, perfect, and we make the shift, very good. Are you okay?
Yes.
The shift is more difficult than other techniques. Now, other side again, relax, Okay, drop your body, relax, relax, yes, fall down, good. I prepare myself for the contact, so the contact is right here, okay, relax, don't tell me, good. I prepare for a little rotation, don't tell me, good, more relaxed, good, perfect, drop your body, okay, good, we go. Okay, did you feel it? Yes, this is an important shift on the occiput. Very good. Are you okay?
Yes.
Okay, what's the feeling? How do you feel?
I'm relaxed.
Good? Relaxed,
Yes.
okay. So, thanks to my model, because she is helping us knowing something more about anatomy, about physiology and pathology, and to understand more about the treatment, okay? Thank you to everybody. You know how to say
Thank
goodbye.
you.
You joined this, okay? Correct? Bye bye. See you.
Bye bye.